Good afternoon, everyone. Today is the May 19th meeting of the Finance Committee, and my first order of business, since I see we have a quorum, is to call on members of the committee to make sure we can hear and we can hear them. They can hear us, we can hear them. So I'll call in the order I see them on my screen. Lynn,
Present.
Counselor Brevick,
Present.
Kathleen Mitchell,
Present.
Tom Porter,
Present.
and Anna Devlin Gothier.
Present.
One counselor told me he's going to be absent. We have one other resident member. If they come, I'll recognize them. We have two main items on the agenda, but the second has multiple parts. The first is the library, and I see that Sharon has joined us. And then the second is a broad group called Community Services, which has multiple different entities in the town involved. So we've moved, just so people in the public know, we've moved public comments to the end to make sure we can have a discussion before we get the public comments. So I urge your patience. And Sharon, welcome. And I'm assuming you're doing the presentation.
Yeah. Hi, everybody.
And,
Hello.
and thank you also for responding to our questions in writing. That was very helpful. And you can assume we either have already read them, but we may still have follow-up questions.
Absolutely. Thank you. Really helpful. Thank you for sending them to me. It's helpful to know what you guys are thinking, but before when I'm putting together the presentation. First, I wanted to introduce Trustee President Austin Serrett, who is also with us.
Welcome.
If I can, is it okay if I share my screen?
Yes, and I'm just going to take a moment that I see Joe Jane has joined us. Joe, can you hear us fine?
Yes, everything's great. Sorry I was late. I just came back from an appointment. Thank you.
Okay. Sean is in charge of screen sharing, so if he lets you, you can.
Yes. There we go. Okay. Please hold. Okay, here we go. Thank you again so much for having us. Let's see. Hang on. Start here. So I have integrated a lot of your questions into my presentation. Happy to answer more questions, clarify at the end. We're going to start with the budget summary. So our proposed FY27 total operating budget is for $3,253,135. It's a 5.3% increase over the library's FY26 budget.
Sharon, I'm so sorry to interrupt you, but we're seeing your current slide and next slide, so maybe you switch the windows so that we can see the big slide. We're seeing like all the controls.
How do I? Yeah, that is so weird.
If not, that's okay. If you
I
have
have
notes,
no
then
idea
we'll see
how
the
to do
notes,
that.
but
I'm so I don't have notes.
no worries if not. That's fine.
I'm so sorry. I need a pocket Athena to come home with me and help me with my
Sharon, if you click
I'm
on
sorry.
display settings, is there an option to not have it that way?
It says swap
presenter and slideshow. Try that.
There you go.
go.
That's perfect.
That's perfect.
Oh, great. Okay. Okay. So for FY27, we are going to assume that we're going to be providing services out of the interim space, 101 University Drive, for 9 months. That's what we've budgeted for. So that's why our utilities costs are low. You had a couple questions about special collections. We do expect we're budgeting $15,000 out of that account for various special collections activities, including anything related to the Section 106 MOA between the town and the state and the library. And so this special collections account is separate from our corporate account. It's donations that have been given to the special collections department over many, many years, and those funds are restricted to special collections. So no, we definitely do not charge patrons for the use of special collections.
And Sharon, as you talk, is there a fund then called the Special Collections Fund that you have?
Yeah, exactly.
So in addition to the endowment fund?
Yes,
And-
but I mean, it's teeny. There's like $30,000 in it. It's
Okay,
small.
thank you.
Thank you. Revenue sources. Okay, so the library trustees have submitted a request. It's for 3.85% increase to the town appropriation. And the trustees approved a 4.6% draw rate from the endowment. Regarding gift funds, both the trustees and the Friends approved a $45,000 Woodbury Fund grant for the purchase of circulating materials, just for FY27. In addition, $129,123 is budgeted to be gifted to the library from donations to the Friends, and that money will be used to purchase circulating materials and to fund public programming. FY26 annual fund donations to the Friends, you all asked me about this. They're essentially equal to those that we've received in FY25, FY24. So this has made us really happy. On the flip side, we do think that the annual fund is not increasing at this point because donors are giving to both the annual fund and the capital campaign. And the Friends are responsible for the capital campaign, so all of those funds are in Friends accounts. But under the MOA, the Friends are required to hold the capital campaign fund separate from their annual fund donations. As far as the endowment goes, the value of the endowment on March 31st was $9,208,710.93. And the separate Woodbury Fund as of March 31st was $322,918.98. And that was after a $500,000 donation to the capital campaign in FY26. Regarding expenses, so we have budgeted for a 9.8% increase to benefits costs and a 2.2% increase to book purchases. All of our state aid award will be used. The majority of it, 97%, will be used for staff salaries, and about 3% will be paid to the town in the form of rent for library services at the branches. And 2 of our full-time positions will remain unfilled. Regarding staffing for the expanded library, so what we've been saying was if we were projecting that if we would need to add any additional positions, it would be for a custodian. But what we're doing is we're not adding any new positions. We have had these 3 full-time positions that have been vacant for a handful of years. And so for FY27, the trustees spent a little bit more money, took more out of the endowment draw in order to fill one of those positions. And so
Sharon, can I just ask you a question as you go along?
Mhm.
Because I'll forget them otherwise. So you're adding the teen librarian, but would you wait to add that person until until March when the new open, or would you be adding them for the full year?
we'll start the process in July, and so the process takes a few months. So we're not going to wait until March. We need the person to help our Cecilia, our teen librarian now. So we'll be bringing them on sooner rather than later.
Okay, thank you.
Yeah, and so regarding the teen and custodial positions, it's not an additional 1.5 FTEs. We're filling one full-time position that's been vacant and to oversee the teen room, and we're hiring an additional part-time person to perform custodial duties. Staff and statistics. I was so glad that you asked this question. I did email town council with the library staffing charts from FY18 to FY25, and they look like the FY26 chart that's showing on your screen. So because the charts are arranged by library department, it helps you see how many people are within each department providing those services, but it's not arranged by, hourly, how often people work in a week. So I gave you the FY26 FTEs, the actual calculations, but I don't have that going backward. Maybe HR could do that, run a report, or maybe Sean can. But what's deceiving about this chart is the fact that the staff don't work in silos. They don't only work in their department. They move around depending on what the needs are. People get sick, go on vacation, and people have to fill in for each other. So most staff are working at all 4 circulation desks between the kids and adult and the 2 branches. Most of the library department heads have to work the reference desk. Most staff continue to public programming, so that's for all ages, kids, teens, seniors, the branches. Many staff members contribute to collection development. They help with IT. So it's a very well-rounded group of really incredible people. And so we're lucky that they mingle. And more statistics. I love that you all asked this question as well. I have emailed town council the circulation and programming statistics for FY25. All libraries from across the state, this is a requirement, is to keep track of all of these figures. So obviously you can't read what's on your screen right now. So I sent it to you, and you can run charts on the Massachusetts Board of Library Commissioners website, so you can compare libraries from across the state. Let's talk about the building project. So the big question is, what happens if we have to draw down the endowment? It's a really important question, and I would argue it's the question. The short answer is to be determined. Fundraising will continue until the endowment is replenished, however long that will take. You asked if this is sustainable, and the answer is no, not on an ongoing annual basis. These next 12 months are crucial. Our need is great. Today, we're asking for donations to expand and renovate the Jones, and a year from now, we'll be asking for donations to rebuild the endowment to maintain library services. So everybody's financial support is critical. If you have not yet donated, please do so at joneslibrarycapitalcampaign.org/donate. I'll wait for you. For those of you at home who need to go grab a pen to write this down, joneslibrarycapitalcampaign.org/donate. We are hoping, if you feel like you have not been asked, here is your official ask. We are hoping to see 100% participation by town council. Again, go to joneslibrarycapitalcampaign.org/donate. Let's talk about our success. So the total project cost is $46.1 million. The town is going to pay 15.7. The CPA funds will fund 1 million. The MBLC will fund in 2 different bunches, one for 13.8 million and one for 1.7 million, which leaves 13.8 million for the trustees. The trustees have paid, Trustees Capital Campaign, they've paid $4,826,644.30, which means we owe the town $8,995,873.70. CPA still has money left in the account for us to use to pay bills. Amherst College will still owe us $250,000 next February is when we expect their payment. The HUD funds are all paid up. So the total pledge amounts that are on your screen were as of May 1st. New pledges and gifts and grant awards are being added daily. So, for example, last week we were awarded a second Massachusetts Cultural Facilities Fund grant in the amount of $200,000. Woohoo! So what I'm saying is that will increase all the pledge payment amounts. That being said, the pledge payment expectations, this is what donors have pledged to us, but it's not a commitment to turn funds over to the town on those dates. Some of the donors have been vague about their payment schedules, and the schedules of many are kind of outdated because of all the delays. We do expect to make another payment of $500,000 to the town before the end of this fiscal year. We do expect to move into the new building in the spring of 27. We have a year. Fontaine will complete their work. Furniture will be moved in. The books will be moved in. Staff will unpack and arrange shelves, and then we'll reopen. We are not sure when the MBLC will disperse the final payment to Amherst. We're guessing it'll be sometime during FY28, but I'm not even sure beginning, middle, or end. It's based on the MBLC's, they have a lot of construction projects going on all at once, and they have a cap, the amount of money that they're allowed to disperse, and that dictates when they can pay us. So the possible disbursement schedule is on your screen right now. And so at that point, in FY28, after the MBLC gives us the final 1.6, the trustees would give the town whatever the balance is. And if we have not raised all the funds, the trustees have another year to decide. They're weighing options between a drawdown of the endowment or working with a local bank and mass development. And so once again, please donate at joneslibrarycapitalcampaign.org/donate, because every donation makes a difference. That's everything I had prepared, and now I'm happy to answer questions.
So if you, and just so everyone knows, I saw this morning that this chart set is in the packet. So, so I think we can take it down, Sharon, so then I can see everyone. And
Absolutely.
please raise hands if you have questions. Lynn.
First of all, thank you for the presentation and the responses. Just one of the things I think I heard, and I want to make sure I understand it, and that is that if in fact you need to use the endowment to give the town the amount of money as required by the MOU on the date required, that your campaign would then in fact pivot to raising money for the endowment. Is that okay?
Yeah, and so, at this point, we're talking semantics. There's a lot of conversation about, once the building opens, do you still call it a capital campaign, or is it a mortgage burning campaign? Or, we still need to raise $150,000 every year for annual fund, for programming and materials and that kind of a thing. We still need somebody who is paid to oversee raising these funds and then raising the money to replenish the endowment. So, yeah, the urgency is there.
Right. The thing I do want to share, and that is from my own experience with fundraising, and that is that following a capital campaign, it is in fact very normal for you to have an increased donor pool for your annual fund and for any other additional endowments. So I think that's a solid plan. You won't be the first campaign that is not completely funded by the time you open the doors. In fact, that's a rare occasion in my experience, again, with fundraising, but thank you.
Thank you.
Jill.
Thank you so much for all the information and this great presentation and all of the hard work you're doing. I met recently with your development director, and as I have a development background, and shared some ideas for grants and other funding, and I think it sounds promising too that once the new building is open, you'll be able to run new programming, which then opens other doors to program funding, which is a whole nother kind of category that is hard to access when you're in limbo without a space like this. So I just had a very small question on just one of the last things you said in the presentation about mass development and as a backup plan. Can you just talk a little bit more about that contingency plan and what program through mass development and any other info on that you have?
Yeah, so what would happen is, and I only know it at a sky level, we work with a bank. A bank has to agree to take on the loan. The library building itself would be the collateral, and then all three of us, we would work with mass development, providing that long-term low interest loan.
So it's that backing gets you a lower interest rate. Is that what it is, Sharon?
Yeah, yeah.
I'm looking for, and I had just, it was an excellent presentation. So one, you noted that, you pay rent to the town for the 2 branches. And do you know the amount of that? And is that rent supposed to also cover the more or less the operating costs of those, the library part of it, or I have no.
No, but I'm glad you asked. So we pay, and we have paid, so it's $6,500 rent to use the Munson, and it's been $6,500 for a very, very, very long time. This goes back to Ron Bohanowitz days. And so that is so that Jeremiah and his team, they take care of the building and the grounds. So the town takes care of, we just rent. We take care of the inside. The town takes care of from the walls outside, the gardens and all of that. And it's the same way with the north now. We pay $5,000 rent to provide library services out of the North Amherst building. And again, we take care of from the walls inside, and Jeremiah takes care of from the walls outside.
That's
Thank you.
$5,000 a month?
No, a year. I'm
A
sorry.
year. Okay, I just want to be clear on that. Okay.
Thank you. Thank you.
Joe, your hand is up.
Yeah, thank you. That was actually my question too. So thank you, Kathy, for asking that. And Sharon, thank you so much for your time today. This is great. In terms of the endowment, it sounds like you have half of it right now in cash. Is that correct? Or money market fund, half the 9 million?
It could be half. I know we just took a chunk of it out, and I don't have the exact number in my head, but yes.
Okay. And who manages the endowment? Is that public information that we can get, like who manages the endowment and what the performance of the endowment has been, or is that really not?
It's through Vanguard, but
Okay.
now, yeah, and we now go through. It was Mercer, and that was just
Mercer.
kind of messy, and so now we're actually going through Greenfield Savings Bank.
Oh,
Huge
okay.
shout out to Greenfield Savings Bank. They're doing the same thing that Mercer was doing, but for a fraction of the cost. They're really, they really care about the community, and that's what they're doing for us. So thank you
Cool.
for asking.
And is that information disclosed anywhere to the public that you can see the
So
kind of actual
not
performance
yet.
of that endowment, or?
It's a great question. Not yet. We just did the switch like last month, and so
Okay.
even I don't have. We're working on getting the statements online,
Yeah. Okay.
and so to stay tuned.
Yeah,
Yes.
no worries. Sharon, thank you so much.
Thank you.
Lynn and Kathleen. You're muted, Lynn.
I want to go back to the agreement on the North Library and Munson. You talked about doing inside, but I'm assuming that if something major like a plumbing issue happened inside, it's the town's responsibility to take care of that. Is that correct?
Yeah, what I meant was, I'm sorry, what I meant was the walls that just surround the library portion. So the meeting room is not the libraries. The restrooms are not the libraries. So I just mean the library walls.
Okay, and that means you take care of cleaning or anything
Yeah.
else that takes place within the space that you're actually renting within those facilities.
Exactly,
But
exactly.
if
And I should have
something,
given a shout out to DPW, to Guilford and his whole team. You know, they do all of the snow clearing and the shoveling. Thank
right,
you.
just in following up, but if something major happened within that area, like for instance, if you wanted to put in new carpet, would that be at your expense or would it be at the town's expense?
Well, we would go through the JCPC process.
Okay. And also, I agree with your shout out for Greenfield Savings. They've been very kind to the town of Amherst and to other nonprofits in Amherst.
Yeah, thank you.
Kathleen,
Hi, yeah, thank you for all of that. I was wondering if you could know offhand of the 52 people I think who are listed, how many of them receive benefits? Do you have a sort of a breakdown? I know you have like the under 20, the over 20. I didn't know if it corresponded with that or if you have a rough idea.
It's 20 and above. So let's see. So wherever it said
Yeah, that's what, I mean, I
3,
can look at it. I just wanted
okay,
to,
so it's
was
20 and
curious the
above.
breakdown. Yeah.
Yeah.
are there any other questions? Kathleen,
Yes, I was also curious, sort of, are there areas in which the library and the town share any services, resources? I mean, obviously the Munson and the North Library, you've detailed sort of that partnership, but I didn't know like with HR or with other departments, are there sort of shared services or ways in which you're using the town departments to support your work?
All of it. So I love that you asked this question. That's so great. Everybody. So yes, HR. Everybody that we hire, we go through the HR department. We are all town of Amherst employees. So yeah, so the Jones Library is its own 501c3 corporation, but we are also a town department. It's kind of the best of all the worlds. So HR, we work closely with the town manager and who else? The rec department. Huge shout out to the entire recreation department. We do programming with them all the time. Um, I'm totally drawing a blank, but I shouldn't. DPW, fire, police, Cress. Oh my gosh. We in the new library, we actually have an office space for Cress so that they can have a satellite location. We work closely with them. Um, it's on it's one of the best reasons to work in Amherst. Our colleagues are incredible across all the town departments. The town clerk is amazing. I don't what else can I say? Lynn, help me.
Lynn, go
It
ahead,
was a
Lynn.
very, very good job. I think there's an enormous collaboration. That wasn't why I raised my hand though. As you anticipate the move back to the newly renovated and expanded library, you did a couple of things that I think were fairly public during the transition from the library to your place on University Drive. One was come and take out as many books as you can and then bring them back once we've moved. And then the other one was, I believe you had to close for a week or two. And so can you talk a little bit about what you see as the transition opportunity come maybe March?
Yeah, no, fun question. Fun and exhausting. So it was more than just a couple weeks. I think we were closed for a month, possibly more than that. It is a beast, but we're hoping it will be easier to move back in because there was so much math that had to be math to figure out where all of our special collections items were going to go. And because the whole collection of books and circulating materials doesn't fit in at 101. A portion of the collection had to go in the basement of the Munson, and a portion is in deep storage at the bunker, thanks to Amherst College. So at least we know we go to all those places and it all gets moved back. The professional movers move everything back into 43 Amity Street, but then the staff have to unpack everything and reshelve everything and hanging art and all of that. So I'm not sure how long it will take. That's why we're still kind of vague about, when it is that Fontaine will end their portion of it so that our FF&E can be moved in and IT can be set up. So it'll be a long process, but yeah, that's really all I can say for now.
And just follow up on that. Is the money for the move in the operating budget or is it in the in the campaign budget?
It's in the $46.1 million overarching total project cost.
Thank you.
Thank you.
Joe?
Oh, yeah, thank you, Kathy. Sharon, thank you so much again. I'm just curious, this is kind of a really dumb question, but the circulation programming statistics, it's very curious looking at these. Can you talk a little bit of just about the growth of these over time? We have the 2025, fiscal year 2025. Have you seen significant or kind of growth in these areas like, adult books and all the different categories you have here? Has this generally been historically kind of these numbers have grown over the years, or can you talk a little bit about that?
Yeah, what a fun question. Thank you for asking.
I'm good.
So,
College.
So 2019, that's what we say was our last normal year,
Okay.
right before COVID, and the numbers back then were higher than they are now.
Oh, interesting.
COVID happened and everything took a nosedive because we weren't open for
Sure.
many months, and even now. So how many years ago was it at this point? 2 years ago was when the North Amherst Library was shut down and we moved and operating out of an interim space. So Circ Stats went down there, and the building project and all of the hubbub has certainly affected statistics. And then last year, as Lynn had pointed out, we had to close. So none of these stats would I say are normal.
Gotcha. Okay.
I would, you know, and therefore, once we reopen, it, you're not even going to be able to compare that with 2025 or
Right.
24 or even FY19 because it's going to be such a bigger space.
Gotcha. Right. It's like a new baseline. Yeah. Okay.
Yeah,
Yeah, that's cool.
exactly.
Thank you so much for sharing. I'm just, the business of the library. Thank you. I
Yeah.
appreciate it. Thank you.
Thank you.
So Sharon, I have one on the once you're open. You have a fairly large community room, meeting room, and then some others. Does the town, if the town wants to hold, our town room is limited to some extent because of the way the podium is. If the town wants to hold a meeting there, or another group, is it wired so that it could also be on Zoom? Is it set up for electronic, or would it mainly be in person?
No, it will be, it will have all the IT, not as much IT as what's in the town room. And I'm not sure if we will be able to broadcast live, but we could certainly do a Zoom kind of a thing, using an owl, that type of thing. I'm not sure about Amherst Media hookup. I'd have to look into it. It's not
Okay.
it's not the
But
top
you'd be
of
able
my,
to, you've had some large video screens, so if you wanted to do a presentation, it would be on a screen.
yeah, absolutely. Yeah.
And if it's a town-sponsored meeting, does the town pay?
Oh, no, no. No,
Okay.
no matter what, there's a fee schedule, and as long as it's a nonprofit and anybody can come to the meeting, everybody can use the spaces for free. It's not until you start, if you want to hold a private meeting and you are charging people to go to that meeting, that's when we start to take a cut. But for the most part, our spaces are free.
Okay, thank you. I'm looking around the screen. I'm not seeing any other questions. So that you're coming this well prepared was a gift to all of us. So thank you very much.
Thank you
Both,
very much. Thank you for
you
having
know,
us.
both that we don't have to go through specific numbers, we have them. So I don't think we'll have any follow-up because we were asking you now, but we want to thank you. And thank you for the town budget side coming in on budget to what we
Thank you very
provide
much.
to put. And I realize, you know, I did most of those questions. You had to go way up on the draw of endowment, and that's, you've already said this is worrisome. You can't continue to do that if you don't have an endowment. So you'll have to figure out, as you said, to be determined. That was
Yeah.
probably a good
Yeah.
phrase at this point.
And that's
Kathy?
actually an excellent segue. Jones Library, capitalcampaign.org/donate. Go there now.
Kathy,
Yes, go ahead, Austin.
so again, I wanted to speak to that very quickly and then just say one other thing. Endowment draws vary. There's no fixed endowment draw. Institutions of various sizes sometimes take a lower draw, sometimes take a higher draw. So no one should, I think, come away with the idea that a reduced endowment, we're just going to keep drawing at the same level. Responsible endowment management requires that we try to preserve the capital, but it also requires that we look at the needs that need to be fulfilled.
Yep.
The other thing is just, I want to say what you all already know, which is the town really needs to be incredibly grateful to the volunteers who have raised now millions of dollars to support this project. They have more to go, but they've done an extraordinary job. And lastly, I can't say this without any depth of knowledge, but surely the town does not have any better public servant than Sharon Sherry. And her work on the project and her thoroughness and responsibility are displayed today. So she gave a lot of shout outs. I want to make sure that the Finance Committee gives a shout out again to Sharon Sherry. Thank you.
Thank you. And thank you for joining us. And you are welcome to go back to your daily lives. Thank you very much for coming. So Sean, now we have a fairly rich mix of people, and I don't know which order you would like to take them in.
Yeah, so if you check your email, you now have a file with responses to the questions that were submitted, but given you just got it a few minutes ago, we'll probably go through a lot of those questions. You know, we'll summarize the responses to those questions. So I'm thinking we'll go just in the order that the budget goes, which is that we will start with Kiko Malin, who is our public health director, and she's also our interim overseeing of senior services. And so Kiko, I think if you want to maybe just give like a really quick summary of you know, your work, and then if you want to summarize your responses to those questions you sent, I took a look at them, they look good. If you want to just start going through those, I think that's the best way to proceed.
Okay, sounds good. Everyone can hear me okay?
Yeah.
Yes, all right. Good afternoon, everyone. It's nice to see everybody. It's nice to be here. So yes, I'm happily serving in two roles for the second time that I've been wearing the interim senior services hat since we've had some leadership transition, but I'm feeling excited about a possible new senior center director coming in the next month or so. We've had some good candidates. So, but I've been, happy to do the job. It actually facilitates in some ways really good coordination of services here in the Bangs to have one person overseeing these two externally facing organizations in the Bangs. And I've actually sort of taken on this role of being the Bangs building manager in addition to running programs, because there are things that come up just to facilitate smooth workings of services here, and I kind of jump in to help them. So I'm happy to be doing that. I've been the public health director for almost 3 years now, and really grateful that our budgets have remained stable. They're small budgets for both senior services and public health, but they help us to do the things that we need to do, the core functions, and I'm just grateful that they have not been cut. So that's wonderful. I think with that, I also just wanted to say to Sharon, the library has been a great collaborator with public health. So there are a couple of staff in the library I guess she jumped off already, but just so you all know, that are very attuned to the needs of unhoused people and people who might have substance abuse issues or opioid addiction. And there were some questions in my, you sent me some questions about the opioid settlement funds, which I'll get to. But we have been collaborating with the library to make sure that there's access to naloxone, which is the medication that can be used to reverse overdose, in all of the libraries. And staff have been very open to making sure that information is there and available to people who might need it. So that's just another way that departments in town collaborate with each other. So with that, I think I'll just jump into starting to go through the questions that you asked of public health. And apologies that I didn't get this information to you well ahead of time and I don't have a beautiful PowerPoint like Sharon's, but we'll go through these questions. My budget's not as impressive as hers, so it doesn't warrant a big PowerPoint presentation. So the comment was made that the staff work is impressive with only 1.8 FTE. And, certainly Olivia, who's our public health nurse, and I are very dedicated to our work and we do work hard. We couldn't do the things that we do without additional help that we have. So that's not reflected in the org chart that is in the budget book. But we have assistance in the form of a public health program assistant who has been with us now for almost 2 years. Her name is Maheen Ahmed. She's a UMass Public Health School graduate, and she does, a lot of the answering of the phone calls, triaging the emails that we get, responding to clients who come to the door and need some information, or supplies, tick removal kits, gloves, those kinds of things. She handles all that, and she also does a lot of our public health education, updates the website. So these are all things that I don't have time to do, and she does a beautiful job of that. We also have a very part-time administrative assistant, Nancy Schroeder, who works 12 hours a week just in the mornings, and she's been here for a long time. She's our most senior public health department employee and has been a real valuable asset to me just in terms of conveying historical knowledge about things that happened years ago, way predating me, and just how the town functions and who to call and that sort of thing. And then finally, we've had someone who was an intern last summer, again, a UMass Masters of Public Health student, Haley Barrows, who we've been paying through the opioid settlement funds. So I'll tell you more about opioid settlement funds, but just so you know that those funds are in place to mitigate the impact of the opioid crisis. And they are supposed to be really geared towards those people who've been most impacted by the opioid crisis. And those are people who use drugs, who are in recovery, or the families and loved ones of people who use or have used opioids in particular. And so our job really was to do a needs assessment and then to plan some programs around those data. And I did not have the bandwidth to do that. So we hired Haley as a student intern in the summer, collaboration with the School of Public Health at UMass, which I work very closely with, and paid her out of opioid settlement funds, which is an allowable expense. You need staff to do the work. So she came on as an intern, had a great experience, did a comprehensive needs assessment, which I provided a link to in the answers to the questions that you have. And from that, we've been doing some activities. So again, more on that in a minute, but those are the people who help Olivia and me to do our jobs. And we wouldn't be able to do all the stuff that we do without that support. So we find a way to make it work. One final thing I'll say about staffing, and then I'll stop to see if you have any questions about that, is that I always look for opportunities. I did apply to, well, I guess a year and a half ago, to the CDC for something called the Public Health Associates Program, where they assign an emerging public health professional to work in a health department, and they pay that person for 2 years, and they pay for their room and their lodging, room and board, and all that sort of stuff. Unfortunately, we didn't get chosen, but I do have an intern coming this summer that I found through the Mass Department of Public Health, and she will be paid by the Mass Department of Public Health. So I really firmly believe that interns should be compensated for their time, and I also really value the opportunity to mentor emerging public health professionals. I've been in the field for a long time, so I like to have young people to work with, and so I'm happy that I can continue to make that happen for our department. I'll stop and see if you have any questions about that.
I'm going to look to see. I'm also trying to scroll through. Kiko has given us quite extensive answers to questions we asked, but Lynn, I know you formulated a lot of any follow-up questions on staff. I thought that was a really good sense of how there are more people working with you then appear in the graph in the budget book. Lynn, go ahead.
Do you have any people working with you that are working with, this was without disclosing names or anything, that are working as part of the tax write-off?
Not in public health, no.
Okay. I would wonder, given the talent of some of our residents in Amherst, whether that might be possible.
Yeah, I think I think there's a lot we could be doing with the tax work-off program, so that's a great suggestion.
Okay, thank you.
So do you want to continue then, Kiko? Because
Sure.
we'd also asked about home visits, whether you leave the building. Yeah.
Yeah. Yes, I'll get to that in a second. There was also a question about CRES and collaboration with CRES. Do
Okay.
you want me to address that first?
Yeah, that'd be great.
Okay. So as I mentioned, I really feel in the 2.5 years, almost 3 that I've been here, the departments and the banks have really come together to work collaboratively. That's all of us are very interested in working outside of our lanes and in figuring out how we can, just communicate well and collaborate effectively to best meet the needs of the community. So, and CRES is something, I used to work in Northampton when the DCC, so the CRES analog, the Division of Community Care, was coming up. And so it's something that as a public health person, I've been really invested in. I think it's an important component of public health to have an alternative responder system in a town. And so I really wanted to be able to support CRES from the second I walked in the door here as public health director. So I think I wrote in my response here that there's really not a week goes by, sometimes not even a day goes by in a week that CRES and public health aren't talking to each other. If it's in the hallway about someone that we met with who needed something and we sent them to you and what happened with that, is there some other way that we can follow up? I drop down periodically to just check in with Camille and ask, what about this thing that we talked about last week? So it's very open communication. In terms of practical examples, Olivia, our public health nurse, once had to make a home visit to someone where it was a little bit of a complicated situation. I can't give you all the details, but she needed to inform them about something that had happened, and it was a bit sensitive and she didn't want to go alone. So she asked a CRES responder to come with her, and that went very well. CRES responders often drop by and say, hey, we're talking with someone who is having some symptoms of this. Would the nurse be able to take a look and tell us what could happen? And, Olivia doesn't provide medical services. She can do blood pressures. She can do vaccines, but she's a skilled professional. So she can assess what's going on and she can say, I think you should call 911. I think you should do X, Y. I think you should call this looks like it might be this. I really recommend you follow up with your primary care doctor, whatever it might be. But having a medical person in the building is something that all of the departments kind of avail themselves of, and it's really helpful to have her here. CRES in particular has referred many of their neighbors to sit with Olivia and ask questions, get a blood pressure check, get referred to something, just have a listening ear about medically related things. So that's a very good working partnership. Once in a while, we have situations where, for example, we had a TB patient who had to get to Springfield for an urgent appointment to get medication like that day, which was not anticipated, and didn't have transportation. And we were able to CRES was able to take that person to Springfield. That's an exception. It doesn't happen often. And those kinds of things, we're always very, very careful to coordinate with Camille. Does, make good use of limited CRES staffing time? Can this happen? And Camille is always willing to bend over backwards and make things happen if it makes sense. Like if she's short, she will say, no, sorry, I only have one person in the office. Everyone else out in the field can't help you today. But we always try to figure out how we can help each other first before we turn to other kinds of things. Yeah, I guess I'll just leave it there to see if there are any questions about that.
So, we've split it up between public health and seniors, but if any of these things apply to both, now that I think you've had to be interim for both of them more than once. Am I right?
Yeah. Yes.
So yeah. So if it also applies, because you talked about the 3 in bags working closely together, meaning CRES, senior, and public health. I think.
Yeah. Yep.
Yeah.
That's right. Yeah, thank you for that, Kathy. I will talk a little bit about that. I also wanted to mention that DEI is in the building as well. And for me, I've always considered racism as a public health issue. Diversity, equity, and inclusion are public health issues. It's how we create healthy communities. So I also work very closely with Pamela, and we do a lot of projects in common. And so we also, all four directors, three now, but when we have a senior center director, all four directors of those departments do meet monthly. We sit down for an hour just to sort of talk about what's top of mind, how can we help each other out with our work, what's the challenge of the month, just to kind of support each other and figure out how we can work more closely. So that's something we've been doing for a little while now. In terms of senior center and CREST collaboration, I think it's been a bit of a bumpy road. Early on, there was, I think, misunderstanding about what CREST could do, what senior center had to offer, leadership, different perspectives in terms of leaders in each of those departments and the way they might go about things. Now I think we have a smoother relationship. I've really talked with the senior services staff about how CREST is a resource that we should be making use of. And there are many seniors who come in who have issues that could be managed through CREST and issues that were managed through senior services. I think, and I'll talk about this a little bit more when I get to the senior services section, but there was a question about social workers, and there is not currently a social worker in the senior center. There used to be a social worker job, and I think in the past, directors themselves have been social workers, but there is nobody in the senior center staffing right now who is a social worker. I'm a social worker. I have an MSW. I'm not a practicing social worker, but I have that orientation in my work. And I think that is something that changed, again, predates me, staffing configuration changes. We had lots of conversations with candidates for the senior center director job about the importance of a social worker in the senior center. And I think it's something that really needs to be addressed. CREST responders are not social workers, but they do social services type of work with people. And so we've been working recently on being very clear about what are the current services that senior center does offer. It's mostly resources and referrals. It's not so much true social work. It's a lighter touch type of thing. And CREST, I think, also does similar stuff, but they do more in-depth things with some aspects, and then the senior center can do more in-depth things with other aspects, like signing people up for Medicare. That's a service that the senior center offers. So if CREST has a senior that needs that, they'll refer them to the senior center. So I think we're still working it out. I think there's cordial collaboration between the entities, and we're planning to do a meeting in early June for all of us to really sit down and understand, here's what senior center does and doesn't do currently, here's what CREST does and doesn't do currently, public health, DEI, how can we all continue to communicate and collaborate effectively in this shared space of the Banks Community Center.
Thank you.
Sure. Home visits, leaving the building. So public health is all about community engagement. I feel like we should be leaving the building more than we do. My scope of work as a public health director for a local municipality is huge. It's very broad. And so there are a lot of things that come across my desk. I could be in my desk all day long if I wanted to, but I try to get out. We really make a priority of doing outreach events. The photograph that's in the budget book is from the Global Village, where we had a table there. And I have talked with our staff about how important it is to do outreach. We go sometimes to the apartment complexes when they have, if there's food that's being delivered or sort of handed out through the food bank, we sometimes will go and just kind of be there and introduce ourselves. I feel like we need to do a lot more of that, especially because we're going to be moving to the second floor. Right now, we're on the first floor. We are very accessible to the public because we're right near the door that a lot of people come in and out of, near the parking lot off of Johnny's Tavern. Soon we'll be on the second floor. We will not be as visible. All the more reason for us to be out in the community more. To the question of home visits, Olivia's scope of work is not huge as a public health nurse. As I said, she doesn't provide a lot of services. She could do blood pressure checks. She does vaccines. So if they're homebound, folks who are homebound, they need a COVID or flu shot, she is absolutely down to do that. And she does that in the fall. She has a group of people that she keeps in touch with who expect her to come and give a COVID and flu shot in the fall. She has done visits to folks who have TB. She manages all the TB patients in town. There are not that many of them. And make sure that people take their medication. It's something called directly observed therapy, DOT, that should be done in person, can also be done virtually, but she sometimes will do a home visit for that. It's a rare thing. We don't have a lot of that. But mostly her work is she has people come here. She does some vaccine clinics here, and she will do blood pressure clinic checks here, office hours. So home visits aren't really a big part of public health nurses in local public health the way it's currently configured. There is a chance that the Mass Department of Public Health is working on a new universal postpartum home visiting program where a nurse would go to visit a family that had just had a baby within 2 weeks of delivery and just provide support to the parents, mostly the birthing mom, around breastfeeding and whatever else. And that's something that Olivia's interested in, and she's on a task force of people that are helping to plan this. So it may be something that comes to Amherst in the future. But in general, public health nurses in these small scale local municipalities don't do a lot of home visiting. It's not a big part of their work. And then just to talk about the opioid settlement fund. So as I mentioned, with Haley's help, the intern who was here, we did a survey. We got more than 100 responses from people in town. We also used the results from another survey that was done by Hampshire Hope, which is a opioid task force for the region. We did some in-person conversations with people with lived and living experience of using drugs. And we talked also with a lot of providers in the area who serve people who've been impacted by the opioid crisis. So she put together a really nice PowerPoint that sort of outlines what the key themes were that came out of this needs assessment. And they were primarily around the need for more harm reduction efforts, the need for upstream prevention efforts, and peer support. So we're now working on programming to implement, to address those kinds of concerns or needs that came up in the needs assessment. And there's a lot more information on their website about all that if you're interested. I'm happy to answer questions. I know I'm probably taking up more time than I should be, so I'm just going to be mindful and stop there unless you have questions.
No, you've actually given us quite a bit of information in your written comments too, Kiko. So I'm looking for any hands because the next transition after this is senior center. Lynn.
Yes.
I am concerned about your move to the second floor and wonder if signage could help to make people aware of the fact that we still have health services. The other piece that really goes along with this is I'm sure you're getting a lot of questions right now about the whole virus that was created with this ship that, and the mouse rat poisoning kind of thing. But given your response to COVID, which was the department's response to COVID, which was astounding, and the number of volunteers that worked with you, I just want to make sure that our community does not lose sight of the fact.
You just muted
You
yourself,
muted
Lynn.
yourself.
I do not want to lose sight of the fact that our community does have a public health function and a staff public health body. So however we can make sure that the signage on the first floor as you come into the senior center, both from the Johnny side and the front of the building, really points to that continued and where you're located. Thank you.
Yeah, thanks, Lynn. I mean, we've talked a lot about signage. I think the Musante Health Center, which is, in the basement of the building that I work very closely with, are also concerned about signage because almost every day we have people coming to the health department thinking that we're the clinic and we have to redirect them. So, and I've been bugging Bob Parent, who's the project manager on the renovation, about the signage. So I think that's really, really important. And just to reassure you, we actually have not gotten any calls about hantavirus so far. I think that the messaging has been pretty good. That it's not anything along the lines of what we experienced with COVID. It's definitely concerning, but not to the point where we're getting calls from Amherst residents about it.
Okay, thank you.
Sure.
I think we can go to senior center and the other Kiko.
Right. Okay. Different hat. So there was a question about volunteers and the numbers being lower than earlier years. I think in general, I think the senior center really took a hit during COVID. Now, also, I can't take credit for anything the health department did during COVID. I was not here, and I wasn't here, went to witness what happened with the senior center. But I see the numbers, and I think that especially with seniors, senior centers in general have experienced that the rebound has not happened quickly. You know, like the Meals on Wheels used to have an in-person dining feature, which was discontinued obviously during COVID, and that never really came back to life. And I think people say that they're interested, but what I hear is that we try to resurrect it and then it doesn't really take off. So, you know, things have shifted a little bit in our society post-COVID. It doesn't mean that we can't get these programs back up and running, but I think we need to put a lot of attention to them. And I think volunteers are a big part of that. As you pointed out earlier, Lynn, there are amazing people in this town, and we could be doing a better job creating opportunities that are interesting to volunteers, coming up with new programs and ideas of ways to help seniors that could use volunteer labor. And again, this was something that we talked about in our interviews with senior center candidates is, wow, we really need to beef up the volunteer program. So I think it's just an area of a lot of opportunity, and the staff have some great ideas. They need someone to come in and help direct them to make them happen, these ideas that people have.
While you're on that specific thing, let me tell you what prompted that question, and that is hearing from people who would like to be part of the tax write-off program, but feeling that the opportunities are not as broad or as inclusive. So for example, I guess at one point there was a receptionist at the main entrance to the Bang Center, and that position used to be run by volunteers, and people have suggested that that was removed, and therefore that opportunity doesn't exist anymore for tax write-off.
Yeah, I had heard that too. And I think the building in some senses will be less confusing with public health on the second floor because the senior center will be the only thing on first and ground floors. I don't know why that was I think the reason that was discontinued is that person really didn't have a lot to do because there wasn't much traffic, or people would just go right up the stairs and didn't stop in that desk, or they came in the other entrance, or it just wasn't in the end of the best use, I think, of a volunteer's time. But that could shift post renovation. I think it's an important thing to keep in mind. And the other thing I wanted to mention too is that there will be a wellness consultation room on the first floor that will be part of the senior center. And so I think that's where Olivia, our public health nurse, can hold some of her office hours. So she still has a presence on the first floor. Some of those healthcare services that she delivers, I hope, can still be on the first floor. But these will all be worked out as things wrap up with the construction here.
So, while we're on this topic, Kiko, there is a fairly large volunteer group called Amherst Neighbors
Yeah.
that is focused largely on seniors. Do you work with them, and to what extent does that mean the people who used to work directly with the senior center are now, I mean, I know a bunch of people that drive people to appointments, go over and visit them, help them move furniture. I mean, it's a broad array of seniors largely seniors helping seniors. There are a few younger people, but
Yeah. Yeah, I think that the ties between the senior services here in Amherst and Amherst Neighbors could be much stronger. And I've heard some of the staff say that same thing. I think I don't know if it used to be stronger in the past and if it dissipated under prior leadership. Not sure what happened there, but I think that's another missed opportunity. And one good thing is that, well, there are many good things, but just one thing to point out on this note is that the Council on Aging has been sponsoring these senior SIPs get-togethers in the evening. So it's really, I think, Jean Horrigan's brainstorm, or brainchild, I guess is the word I want. And so they've had a couple of them now, and it's co-sponsored by Amherst Neighbors along with Friends of the Senior Center, Council on Aging, and the Senior Center itself. So it's just bringing people together in a Amherst restaurant, supporting local establishments, food and drink as people want to purchase it, but mostly just to sit and talk with each other. So I think, and I went to the first one and I met some folks from Amherst Neighbors. So I feel like we're paving the way for better collaboration, because that also is something we could be doing a lot more with.
And I don't think it broke off. Amherst Neighbors didn't exist a few years ago. This
really?
is
Okay.
this is
I didn't know that.
This is an organization that was in Northampton, and people saw what it was doing, and then they created a core group to set it up in Amherst. So I just know that because I was at one of the founding meetings on it. So I know it's not that the ties used to be closer. It used to be the nothing to tie to.
Right.
Great. Okay, that's so helpful. Thank you. It's good to know.
Exactly. It's totally correct, Kathy.
Okay, and then in terms of the Crest Senior Center collaboration, I think I covered that already. Definitely working on that and it's going well. I talked a little bit about the social worker. So, I mean, most other senior centers, as I understand it, do have a social worker on staff. The person that we have now, Lucas, he does do some social, he's not a social worker, he's also a master's in public health, but he understands the resources in the community and has, he does some connections for people, but I do think that there is a deeper level of social work that needs to happen. I think that there are many seniors in Amherst who could benefit from some type of case management. I think I wrote this somewhere in my notes. It's not something that the public health nurse has the bandwidth to do. I do feel like it's something that could come out of a senior center. I'm curious. It's not really my job, nor do I have the time to really research this, but it's one of these things that I would pass on to the new director when that person starts, is an interest in really understanding if there can be some more follow up with people. You know, someone comes in with a particular situation, you don't just connect them to resources, but you make sure they get connected. You call them next week and make sure that they're following through. You go and visit them maybe in a month to see how things are in their house. You know, that sort of thing is not something that's currently happening in our senior center. I think it does happen in other senior centers. And I think especially these days with isolation still being a really significant concern for older adults in our community, that that's a service that could be provided by our senior services here in Amherst. There was a question about medication management. That's a little bit, that's more complicated. You definitely need medical personnel to do that. I don't think that's a service that most senior centers offer. And Highland Valley does seem to cover that pretty well. So that's probably not our terrain that we would enter into. And then for substance use, you know, with the harm reduction work that the public health department is doing, we're just getting that message out to everybody. Doesn't matter age, you know, demographics, where you live. We just want everyone to know that this is to decrease the stigma that's associated with substance use and that it affects people from all across, you know, all ages. And we want people to have resources to keep them alive. You can't be in recovery if you're not alive, is the whole principle behind harm reduction. That's why we get Narcan out there, to save people from overdose. And then the last question just about the bangs, I think I touched on it a little bit, with the
did.
signage, yeah, and the movement. I think it's great that the exercise equipment that's in the basement, which has been kind of a bone of contention, understandably, for people, is going to be put into use in this lovely room in which I'm now sitting. It will be the exercise room. And I think seniors are really happy about that. I've talked with people about it and they're very excited. Now, I think it will be a bit of a policy challenge to figure out how we want to manage that. You know, is it card access only? Do we have supervision in there? Do we need to make sure to get doctor's notes from people before they can use the equipment, stuff like that. But in general, the renovation is going to provide some enhancements that will be really beneficial to seniors in the community.
I'm not seeing any hands, so the last one I think is the veterans, and so you've answered, the one question we had is why is the budget up, and you've answered it. Yeah.
Yeah, and I can, if there's any follow-up questions on veterans, I can answer that, but it's really just driven by the number of veterans that we're supporting. And our longtime veterans agent, Steve Connors, either he was just celebrated or he's going to be celebrated coming up. But he's the one who manages the whole program and has an office, and again, I don't know with the renovations if it's had to move, but he has had an office in the Bang Center, and he oversees that Central Berkshire group, which is run out of Northampton.
And what are the plans to replace him?
So last I knew, they were seeking an applicant to replace him. The person has to be a veteran, so they have some good staff in their office, but that could replace him, but they're not veterans, so they aren't eligible. So last I knew, they were looking for an eligible candidate who was also a veteran.
And we will still be part of the same cluster of 16 towns or something like that.
Yeah, we'll still be part of that Central Berkshire group, which is really good because, you know, we get really good service from them. You have to have one. So if we weren't part of this shared services group, we'd end up having to pay for a full-time individual ourselves. So this allows us to kind of cost share with other communities.
Yeah, and his farewell party was last Friday.
It was
so
last Friday, yeah.
yeah. He did say he might be kind of sticking around maybe on a consultancy basis, down the line, not just yet, but in the future. So, and I don't know exactly what's going to happen with that space. I assume the Veterans Office is still going to be in that office. So that will be the only thing that's not senior center on that first floor once the renovations are completed.
Kiko, I just have a real quick question.
Sure.
First of all, thank you for all you do. I mean, it's truly ground game, unbelievable. God bless. It's amazing.
Thank
Do does any platforms like kind of telehealth or anything, are you able to leverage or utilize any of that in terms of communicating and outreach and dealing with any patients? I mean, are you able to talk to people like online at all? Has that been a factor at all in trying to kind of leverage, your teeny tiny little team over there?
Yeah, well, we don't really have so many patients per se. I mean, the
Okay.
only folks that Olivia would interact with are people that she's giving a vaccine to, which is just kind of a one and done, has to be in person type of
Okay.
thing,
Okay.
or the TB patients or any kind of communicable disease. So we get reports of Lyme disease, alpha gal syndrome, which is a new tick-borne illness. If you don't know about it, go to our website and read up on it. Very concerning. Those kinds of things she will follow up on, and sometimes she will use virtual, like it's just FaceTime or Zoom to
Yeah.
do directly observed therapy with a TB patient. She has done that
She
in
does
a
that, okay.
handful of opportunities, but that's really it for patient care for us.
Yeah,
Yeah.
okay. Is there any area that you see as kind of a bigger problem, or you get more calls on a specific, is it just general health issues, or is it mental health issues, or is it drug related? Is there any category that you can say, oh yeah, this is by far in this area in Amherst, we're seeing more of X versus Y, or is that just a dumb question?
No, it's not a dumb question. I mean, I think we get a lot of questions from people about certainly about COVID. We still get lots of questions about COVID and flu and respiratory illness. And we do an advisory on respiratory illness every fall because it's confusing about what's happening. And the guidance for COVID has changed so much over the years. Still with us, it's just not as much of a factor as it used to be. Tick-borne disease is definitely a concern. We're getting a lot of calls about that right now. I think so that, and we're really focusing on that in this moment because Amherst does tend to have higher cases of tick-borne illness. Like our Lyme, last year we had a bigger proportion of Lyme disease cases than you would think. And that might be because we have a lot of tall grasses in a lot of our recreational areas. So we're going to do a lot of campaign educational work, putting signs out on the trails to just let people know about checking themselves for ticks. So we get those kinds of calls. And then we get calls about Puffer's Pond. Can we swim in it? That's a big one for the summer. We get lots of calls.
Okay. Interesting. Okay.
But in terms of other like sort of disease issues, or I think mental health is obviously a concern in terms of when we interface with people at the bangs who are coming in here with questions and concerns. It's a lot around mental health issues.
Okay.
So we don't get calls about that, but we see that as being really an issue in our community.
Okay.
Yeah.
Thank you so much. I appreciate that.
Sure.
Thank you.
Kathleen.
Thank you. Yeah, I just wanted to ask if you, specifically with the senior center, do you have partnerships with any of the colleges? I moved from a college town where fraternity members shoveled snow for seniors. So I was just curious sort of what the history of the partnerships are, if you avail, I imagine you avail yourself of large pool of potential volunteers there.
Well, it's almost as if you've been eavesdropping on our conversations of earlier today, because I was talking with the staff about this very thing. I think we don't have something like that with fraternity folks or college students shoveling snow or raking leaves. That is something that I think we need to institutionalize and make a program out of. There have been some college students that have helped out the reception desk. They painted a mural in the senior center. That was a project with Amherst College. So there have been little fits and starts, occasional partnerships, but not a program that could be sustaining along the lines of what you're describing. And I think there's really a need for that. And it's on the list of things that we should be doing or could be doing.
It's great. And there's several that have been showing up more, Kiko. I've just noticed, on pickup day, there are a few groups up here in the farm. They came and worked on the farm. So there's a central contact that gets out the word. I think Angela helps manage that too, to do that recruiting. So it'd be great.
Yeah, yeah.
So I think I'm not seeing any other hands, and Ray has been patiently waiting, and you covered a huge amount of territory very well. Thank you.
Thank
Thank you
you.
very much. And thank you for what you're doing and stepping in to run two parts of essential services and recruit the new person.
Yeah,
So thank you very much.
of course. Thank you all for your time.
Thank you so much.
So Ray, again, do you want to just kind of give a quick update on rec and then start going through some of the questions? And some of the questions Ray and I worked on together, so I might pop in on some too.
Sure, thank you. Hello, everybody, and nice to see you again. First of all, following up Kiko and Sharon I think it makes a lot of sense for us because those are two of our stronger partners, the Bangs crew and the library. I think we do a ton of programming that involve both of those two departments, and I sat here and listened and watched, and I think I learned something. So I want to just talk about our basically our major changes from last year, which are looming for us right now. We did build an Amherst an aquatics revolving fund that was, I think, it has been pretty successful despite some hurdles and some challenges. I think it was important for us in terms of protecting our staff and getting full-time coverage for our aquatics coordinator, who's done a lot of work to increase our revenue there. And then also the town owned officially the morning movement program, which also those two major developments last year were really big in terms of our relationship with the town and our relationship with the people who use our services. And I think even if it wasn't stunning successes, I think that they both speak really well for the people who use them, for the people who participate in them, and we're proud of those. And so we're looking to try and build on those still. Looking at major changes that we're looking at this year, we did manage to request a support for Cherry Hill that allows Cherry Hill to just the expenses to be covered that we've been under that we've been we've been overspent at Cherry Hill, as you all know, for some time, and we did move some money in to try and take care of Cherry Hill there. And relatedly, we also are looking right now. It's the Cherry Hill Working Group that I know you all have heard about. The Cherry Hill Working Group is really putting together some recommendations for the town manager that will feed our FY28, our whole year for FY28. But a lot of the adjustments that they have noted and they've been communicating with us are ways that we prep and build revenue inside of our programming this year and this summer to allow that to work out. So a lot of the changes that we're looking at right now are operational changes inside of our Cherry Hill operations that potentially allow us to brace ourselves for changes that could come through the Cherry Hill Working Group. Major challenges in this budget season for us as a general oversight, we have not the least of which is a move coming up out of the middle school. And so just our general move in our location, which we are going to have to, we certainly are going to find some costs in there, and we're going to have to find a way to certainly message out our new normal. Our new normal is going to be something that we didn't plan for at the beginning of this year, but we are finding a space there. The wage scale is something that has come up for us in a number of different areas within our department. The wage scale is something that we know will be a challenge for us as we move into this, and our renters blues with ARPs and changes in ARPs and their facilities, and especially for aquatic sake in particular, especially the closing of Hampshire College. We know that some of the dependent money, those variables that we're counting on, we're being tested through those. My staff has been very proactive in trying to find solutions before they end up uh, forcing us into decisions that we aren't comfortable making. We are looking for options that keep us on the straight and narrow. We have a staff that we believe is capable of making sure that we can protect our mission and our goals in and certainly youth sports and aquatics and all those places that our renters blues hit us. We are a department that does not own and operate its own space. And so that's something that a reality that we're walking through. We're also assessing our major commitments, things like 4th of July, things like of course Cherry Hill. We're looking at these major commitments that we have and seeing what happens for us moving forward. But that's an oversight into where we are in terms of what we're coming out of and where we're moving into. That's an oversight for what the big obstacles, the big hurdles that we're looking at are. Um, I could pause if there are any questions about that before getting into the specific questions that were presented to us.
Yeah, Ray, did you say that you're moving out of the middle school or moving someplace else in the middle school? Is that what you just said?
We are moving out of the middle school. Our lease, we had a 10-year lease in the middle school, which is now up. And we're in the process of making a move at the end of the fiscal year.
And where are you moving to?
We are moving temporarily to Wildwood.
So we've been, the town manager, myself, this is town manager, we've been in conversations with the middle school, with the school district and the superintendent. As Ray mentioned, the license has expired. They are needing that space as part of the 6th grade transition, and have been exploring that space basically to move some of their central offices out of the middle of the school to make more space for the 6th grade to go into the middle school. So the current arrangement was not an option for next year. In that conversation, the school district proposed some alternatives to try to keep rec in the middle school. They didn't quite meet the needs of the rec department operationally, and these were good, open, conversations. And so where we settled is that the best space, given what's construction work going on at the Bang Center, the middle school, is that Wildwood would make the most sense and that they could start to get in there as soon as school ends, even though there's going to be some summer programming there. There's a couple quads near the gym at Wildwood that they would make available to the rec department. So that will be likely, unless there's some, curveball or space that becomes available. That's the plan. And then whether that's a long-term home or a short-term home, I think that still needs to be worked out and what other options are available. But rec department's been extremely flexible and understanding, because this kind of came up, the last couple months, and we are like, all right, we got to figure out a permanent home in a pretty short amount of time. So that's the plan.
Do we get the space for free?
I hope so, Kathy. I really do hope so. I think
Sorry, it's
I'm not going to say I'd be surprised if a rental offer was sent our way, but I think this is different than renting the regional school buildings, right? The regional school buildings are owned by a separate legal entity, and and there's other member towns that are part of that ownership, where Wildwood is a town building. So my hope is there will be no rent, especially since we are picking up the cost of that building for the majority of next year.
And will I don't know whether in the summer months you would use it, but there is a gym. It's an undersized gym, but would if you're there for at least 6 months, would be the plan to be using the gym at all, using the fact that there is one?
Yes, in addition to it being a really convenient location for us, one of the first things that we were concerned about when we knew that Wildwood was coming offline was we rely on that gym for a lot of the stuff that we run, AYBL in the wintertime. uses that gym and that space. And then also the possibilities of that space is that without an elementary school in there for the time that we're in, we could program adult sports, adult opportunities in that space, and turn it into a revenue source. We could provide for the town a space to operate that isn't dependent on out of school hours.
The only thing I'll add to that real quick is all of that will have to factor into how much funding we request to manage the building, because with just the rec department there, if the building is really just serving as administrative offices, that's one level of custodial support and maintenance and that's needed. If it's going to be used in a very public way, then that's obviously a different level of custodial support and cost associated with it. So just keep that in mind. I don't think final, I think it's still TBD how open the building will be publicly, and that will definitely influence the funding that needs to be provided.
Okay, you know, I'm looking for other hands, but I'm just looking at some of the answers. I mean, one of the questions was how many sports teams do we have? And I'm going to hone on just one particular. I lived north of Mill River and the recreation area, and I'm there a lot. And we have these 2 baseball fields, and I don't see them being used very often. One gets used quite a bit. Are we down in the number of Little League, baseball, youth league, compared to what we used to be?
Well, I can say that it's the space that is used for Little League. We don't run it. Little League is not run through our department.
Okay,
So tracking their numbers is not inside of our
Okay. Okay,
background.
okay, that's great. So that's not rec department. Okay. So Lynn, you know, we had a series of questions on Cherry Hill, but are there any other areas of the budget before we get to Cherry Hill? Rec department.
I did have one other question. I assume that you continue to have scholarship funds available for students who, or for people who are unable to pay the fee for recreational events.
We do.
Okay.
Uh,
And does that include equipment and uniforms and so forth?
That was one of, in a couple of different ways. The subsidy does not apply to equipment, but we do have a loaner library that we've maintained. Some of our programs that we work with or have MOUs with have operated loaner libraries. We inherited some of those, but then we also that was one of the big gets from the ARPA from our ARPA windfall from a couple years ago. We were able to extend our loaner libraries to help support people who are looking for equipment to play.
And I get the other question, it really relates to the same question we've asked of others, and that is opportunities for people to do tax write-off by working with you in any form. Does that happen, or could it happen?
I was anticipating that one because that came up in a conversation I had with Sean a couple months ago, and also I sort of listened to the conversation here. We've talked about ways to use it. There is some specialty work that we're not quick to say that it would work for us, but in terms of having somebody as a site manager or somebody to work to welcome referees and that sort of thing, we certainly have talked about that. We had similar concerns that I believe Kiko raised about uh, appropriate use of time. If we brought people in, we wouldn't want to have people coming in any of our programs and sitting and waiting and sitting and not being used.
Right.
Our face-to-face traffic, our and who knows what happens with our move, but our personal traffic, in-person traffic has not been as high as it was before. So greeters don't make sense for us in the same way that they may have 5 to 10 years ago. But we have been thinking about ways to sort of alleviate some of our concerns and be able to use people in these fashions.
This really then goes back to Sean, and that is, do we have a coordinated site where people who are interested in this program can see what's available?
So I think the senior center has primarily provided that role, performed that role. Actually, the assessor, and we had a department meeting today, and the assessor's office, the collector, and the senior center team, they're actually going to a training seminar on it in a couple weeks as a group, and then they're going to debrief. But I think they are looking for ways to better communicate the program and make sure, there's been some disconnects where, people who maybe were told they were eligible, weren't eligible. One thing, you have to be an
Right.
Amherst resident to be eligible. And so they're working on kind of beefing up the communication around the program, and I expect that'll roll out in the next month or so.
Okay, thank you.
Jill?
Thanks so much, and thank you for all the work you do. I have 2 kids, and we use your services a ton. Just a really small question on the Independence Day celebration. And I saw you answered it in there, but I saw in the budget book that you have as a objective to assess the value of the Independence Day celebration inside the department's funding and management structure. But then in the Q&A, you say it's funded outside of the operating budget through sponsorships, donations, and vendors. If you could just talk about that a little bit and what you're thinking for the future of that event.
Certainly. We're right in the middle of the heaviest prep time for 4th of July right now. It is not fun. The operating budget does not provide any money for this. It is entirely funded. What I said in the Q&A here is that it's funded entirely through sponsorships, through vendor contracts, through donations. And we make the decision we never meet because of the rising cost of putting those fireworks on. And the rising in order to do it well. And I think that our Becky Demling and our outreach coordinator has done a really nice job of sort of making that into something that is consistent and reliable in front of the community. We're hosting a lot of people there. It's a complete town effort with cooperation with town and UMass University supporting groups. The amount of time and energy that goes into putting that on without a financial benefit. Like, it's not, people aren't coming to the town and spending money at the restaurants. They aren't coming to town and spending money in town. It is a lot of non-Amherst folks. So there's a lot of factors that are involved in it that we are trying to see if it's worth our investment, worth our time investment, worth the coordination, worth all of the frankly headaches that go to making that a really successful program, which I think it has been for the last 3 years. And so when we talk about assessing it, there are some decisions like in terms of just the labor hours it takes to make that work, to coordinate those efforts. There are some decisions that we have to make along those lines that we don't know if it's sustainable based on how little it makes sense from a strictly revenue standpoint. Great event, and we're very happy to do it while we're doing it, but we need to make sure we're clear-headed when we think about it.
Lynn?
Well, first of all, thank you for doing it, and thank you for at least doing it through this year for the 250th. But I also will observe it's a huge number of people that do not live in Amherst, and so it's a service to the region. And I hope that you'll consider in some way passing the hat during the event, or do something that asks people to donate, particularly again, because it's really attended by a lot of people outside of Amherst.
I told Ray to sell hats, not
There
pass
you
the
go.
hat. I said sell hats, and then pay for the next
Only
few
after you
years
pass
of
them. Yeah,
4th of July's. So
great.
Okay, I think next is the golf course.
Oh, may I? There's one of the
Okay.
feedback that I would love to just mention here. It's
Sure.
in the Q&A, but youth sports being down. I want to make sure that I just mention that we have we embrace participation in all the different ways. I think a lot of towns are dealing with the same, getting kids out and participating. Comparable towns are. I want to make it clear that one of the things that hit us in terms of our youth sports number is that the spike in numbers as we boosted our aquatics program. I don't know for sure that they're one for one, like we're taking kids out of youth sports for that, but there is a sense that as like Amherst United has come and numbers have gone way up in the 3-4 years that we've been running that program, that there is it's a zero-sum game, that they aren't still in those other sports. Maybe they aren't trying those sports, but those sports that aren't counted as youth sports are affecting our numbers in ways that we know that there are challenges to try and get people involved, and we're working to try and do that. But I don't think it's necessarily as dire as those numbers may show.
Lynn?
Oh, two comments. First of all, Ray, I'm sure you and every other town has been hit by declining birth rate. And so the fact that it's going down isn't a surprise. But the other thing is, I just want to really, really thank you for all of the work that's going into Morning Movement. It's a phenomenal program, and if you have not gotten to visit it, please go visit it. I'm so pleased to see that we figured a way to how to fund it going forward. Thank you.
Thank you. And last day is tomorrow, so we'll get you all in for our return next year.
So I think the overall question, rather than all the specifics, it looks like the golf course is making money. So there's a question on why not create a revolving fund now, which was one of the suggestions of the working group, because then it would retain some of this money for course maintenance for capital. And then we've gotten several emails saying that one of the course maintenance, and you've sort of talked about it here, that the salary scale is so low that we don't get applicants for it. And I guess my question would be, is there another grade we could list it at because they work with equipment? It's right now the salary scale is at $15, and Cumberland Farms hires for that. And these are people who go out and actually maintain the course, riding around on equipment. So it was the two sides that the revenues are up quite a bit higher than expenses, and the course needs not just fertilizer, but needs people maintaining it, and that potentially boosts revenue up. So maybe you could just talk about, and I know, Sean, this is partly a question of you on why not do this sooner rather than later, and then put some of that money back into the course, because it seems like a business opportunity for the town.
Ray, do you want me to start and then jump
Yes,
in?
please. Yes, please.
I'll start with the second part about the wage scale. So, Ray has raised the wage scale question in the past because a lot of the staff that support Ray's programs are on what we call our part-time wage scale. So it's well defined what roles are at what positions and what levels on that scale. Several years ago, we did a big update to that wage scale when minimum wage was brought up to $15 an hour. We phased in increases to that wage scale over a few years because lots of people are impacted by it, and it's expense. You may think a small adjustment may have a small impact, but it's hard to just pick one position on that wage scale and increase it without kind of reviewing everyone's role for fairness and equity sake. So, for example, if we were to just increase the groundskeepers at Cherry Hill, would that be fair to the lifeguards and the summer camp employees and all the other part-time employees that are part of that wage scale? So that's the kind of the rub, and it's really going to come down to whether it's a priority for the town council and the town manager. But I think it is something we've identified as an issue, because aside from the landscapers at Cherry Hill, we do think like our lifeguard rates are too low and our summer camp rates are too low, and so it may again come down to having a multi-year plan to increase those rates and not try to do it all in one year. Because if we were to go from 15 to 20 in one year, it's probably going to be in the six figures in terms of the impact throughout all the different departments that pay part-time staff. So it may be something that we start to phase in as early as FY27. Maybe we'd have to see what our funding looks like. It wasn't built into the budget, but more likely FY28, and then have it phased in over several years. But again, it would have to be prioritized.
So do we have one part-time? That's it? One part-time rate? There's not?
No, we have a wage scale with positions that have been set at different levels. So there's multiple scales. And I think what you're saying is like, well, could you just move the groundskeepers from, level 2 to level 4? Possibly, but I think again, then our personnel board and HR department might say, is that fair to just kind of cherry pick one group type of employee and move them without kind of reevaluating all employees?
Well, this is going to show ridiculous from my way deep back when I worked for a building service union, where there were people who operated light equipment versus operated heavy equipment. So it wasn't so much an arbitrary, it was what equipment are they working with and what's the nature of the work. So it wasn't so much favor one group over another, but look into what so that's my question. So you do
Yeah.
have
And
different.
I think the reality is it's not just an issue for groundskeeping. I think
Okay.
it's been brought up as part of groundskeeping, but
Okay.
I think the larger point of $15 an hour is just not competitive for any type of position we're trying to fill right now. So maybe there's something that could be done interim for the groundskeeping group. I think that would be between Ray and HR to work that out. But long term, something has to be done to the whole scale.
Okay. I don't want to dominate this, but
No, it's good. That was a good question. I wanted to make sure we
you
shared
gave me
that.
the answer, so it cuts across multiple people that we hire.
Yeah, absolutely. And then
And some of them are not
go
in my department also, to be clear.
many of them are not.
And so can I, okay, go ahead. And then the other flip is the revolving fund, and
Yeah.
linked to that is also if there was a Friends of the Golf Course that formed and wanted to give money to enhance the groundskeeping or something, does it need a revolving fund to be able to do that? Can you set it?
No, so that could be done now, and I'm not going to go as far as Sharon and give our Venmo account so people can make donations, but yes, people can donate now if they wanted to. We have a myriad of gift funds in the town. We have a dog park gift fund. We have all sorts of gift funds. People can make donations. We put it in a separate an account designated for that purpose, and then it can only be used on the purpose specified in the gift. So yes, that could be done now. The bigger question around creating the revolving fund. So I know the working group, their hope was that revolving fund would have been created in the FY27 budget. In talking with Paul and planning for this year, we just decided that there wasn't enough time and communication to phase that into this year's budget. It's whenever we talk about taking a relatively large revenue source out of the general fund budget and also the expenses associated with that, it's complicated, and I think it needs to be well communicated to the other stakeholders like the school committee and the library trustees and everyone who kind of looks at our revenues to see how much money is going to get divvied up to the operating budgets. And so I just didn't feel like I think that recommendation came out in either late March or April. We were already developing our budget and kind of like putting the final touches on the budget. It would have been really difficult to have a fair conversation with those groups, and if there was any pushback, how would we reflect that? So ultimately we decided it would be better to introduce that in the fall. There's a couple other accounting changes that we're planning to introduce in the fall that this kind of fits in nicely with. One is our stormwater fund. We're hoping to bring that back to the council to get that moving. And then also potentially creation of a facility revolving fund. We were talking about rents earlier. And building rents could go into a facility revolving fund and be dedicated for supporting our buildings. And so this lined up well with that. So that was our plan. Now, again, I know the group was really disappointed because they were hopeful that any excess revenues generated by the course in FY27 would basically stay with the course and be able to support Cherry Hill in the future. Right now, when it's part of the general fund, if there's excess revenues, it goes into free cash. like all our other general fund revenues. So one compromise we talked about, and this would have to be, the town manager would have to support this, the town council would have to support this, but it's an option that we discussed is, the town council could in the spring next year, fiscal year 27, transfer, we could provide a pretty detailed projection of what excess revenues look like for Cherry Hill, even if it's part of the general fund, and the council could transfer that into a revolving fund at that time. So while the golf course isn't technically in a revolving fund next year, we could figure out a way if the council wanted to kind of seed a revolving fund with excess revenues. Again, that all assumes the council and the town manager want to create the revolving fund in the first place, which I think there's pros and cons for. Definitely from a Cherry Hill perspective, I understand why if you're generating excess revenue and you're making money, you would want to keep that invested in the course. So that's kind of where that's at. The plan is to bring it back in the fall, and if it's approved and supported, there could be a way to also get the excess revenues into that fund to start FY28.
Lynn, and you've answered my major questions. Go ahead, Lynn.
Do you want to go ahead with any presentation of questions? Kathy?
Well, the questions, you could go through all the questions. I'm just looking at, he did the youth sport, he did Fourth of Supply. And so we were getting to golf course, Lynn. So,
Right.
and I'm just conscious of it's a 2:45, so I want to make sure we have time for public comments. But yes, anyone else should just jump in. And I have the advantage I opened up the responses, so we have responses to some of the questions.
My questions are really around the golf course.
Okay.
Why was I under the impression? First of all, I want to acknowledge that Michelle Miller, who has chaired the Cherry Hill Golf Course, is in the audience, and want to thank her for that work as, again, serving this community as she has in the past. Why am I under the impression that somehow or another all of the expenses related to the golf course are in fact not covered, that the benefits are elsewhere in the budget? That's one question.
Yes, that's true. The benefit costs associated with the employees are in the health insurance budget, so they don't show up as a Cherry Hill expense. Likewise, insurance expenses,
Right.
retirement expenses, all those types of things are in other areas of the budget. So you can't just take the revenue number and the expense number and compare them directly and say that's the profit. There's other expenses that get rolled in if you were to do a full comparison.
And if we created a revolving fund, would it be necessary for that revolving fund to be able to pay for those health and benefit expenses?
We'd have to discuss it when you create the revolving fund that would need to be created to do what the working group wants to do would require the creation of a bylaw. And that bylaw would outline what expenses would be charged to the revolving fund. And
Okay.
so we have some revolving funds where generally I would say we do not charge benefits to revolving funds. Like we have a couple revolving funds that have staff paid from them partially, or in some cases fully, and we have not charged benefits to them. But that would be something that could be discussed at the time of the bylaw if we wanted that revolving fund to kind of be a true, like, all-in cost reflection of the course. That could be written to the bylaw to do that.
The other thing was the whole issue of the maintenance of the property, and particularly of the golf course. The UMass has a turf management program. I know they're exactly opposite when we need management. But I wondered whether there was any way to strike a relationship with UMass on particularly the maintenance of greens, et cetera, golf course, or whether or not there's a way to have our DPW do that. It's a different kind of maintenance than they do for other areas. And I don't know if they have that expertise, but it was just a suggestion.
Well, I'll let you tell Guilford that he's got, mowing the golf course on his
Thanks.
routine going forward. But
I
go
really
ahead.
appreciate that.
I know the UMass thing has come up, so Ray can speak to that.
Yeah.
I will say that we have been reaching out partially in response to encouragement from the working group, but we have reached out. Jose Allen, who runs my clubhouse as my sports director and oversees the Cherry Hill clubhouse, has reached out to turf management. We've talked about trying to build that relationship. and see, the effort has been made before, and we're trying to revisit that now. And so that is work in progress.
Sean, are those fringe benefits also for all the other rec departments? Is that similar? Like those fringe benefits are covered by the town and they're not part of the budget?
So the distinction is really whether something's in a revolving fund or an enterprise fund. So when something's in an enterprise fund, all the benefits get charged to the enterprise fund. So water,
really?
sewer, enterprise funds are much more rigid in terms of they have to reflect all the costs. Revolving funds is sort of in between, and it's sort of a decision. But I would say yes, we generally don't charge benefits to the revolving funds for the staff paid from them. We don't have a lot of staff paid from revolving funds. We have a after school revolving fund that pays for a staff member, and we have the rec department revolving fund that pays for partial staff members, and our aquatics fund. So there's not too many of them, but generally we don't charge benefits to them.
And Joe, when you look at the budget book and police department, DPW, not the enterprise funds, none of the benefits show up in the personnel costs. All those benefits, the town doesn't allocate them back when you're looking at the budget, so we've asked in the past, here's the payroll.
Yeah.
Is it a 50% markup for benefits? Like what's,
probably.
And a couple of years ago, that was the answer. I don't know what the answer is now, but, but that's across the board. All the pension and health insurance is over in another account.
Another account. Yeah, okay. All right. Thank you. Appreciate that.
So if there are no other questions, it's 10 of 3, and with the committee's permission, I would like to open it up for public comments. Is that okay? Yes, I'm seeing nods. All right, we are open for public comments, and Sean, you are in charge. I'm not the host.
Andrew, I'm allowing you to speak and give your comment.
And I'll just do a quick, please limit it to no more than 3 minutes or up to 3, and we don't interact. But we will listen closely. Andrew, you're with us.
Oh, thank you. Okay. I wasn't sure if I was on there because my computer reacted. So I have a nice statement to read here, but before I start, I wanted to respond to some of the things that I just heard here. And it's something fundamentally strange about the town salary structure, that we are requiring the groundskeepers who have to work outside in the summer, in the spring and fall cold, the summer heat and humidity, doing manual labor raking and cutting tree limbs off, to the clubhouse workers who we have no problem hiring. People are beating down the door of Jose to work in the clubhouse, where once in a while they have to check somebody out for $15 an hour, and we haven't had one person applying for the groundskeeper position. So maybe the town has this rule that we have to pay the same amount of money for this person who's working outside 6 to 8 hours a day in the heat and the cold of the year, versus the same people who only work pretty comfortable jobs inside. So I don't know how to solve this, but this is a fundamental problem, because clearly people are not applying to one job, and the town has no problem filling these other positions. So, question, this should be asked. The other thing is, there's only one overheaded salary position at Cherry Hill. This is John. Everybody else is unbenefited. And I think Ryan Diplock, who did very careful analysis early this year as part of the Cherry Hill working group, he showed that there's a profit if you include that, even if you include 10% of Jose and Ray's overheaded salary to a Cherry revolving fund, there's still a profit last year. And this year, there was a 10% increase in the fees. So the membership and the green fees were increased by 10%, which immediately gonna increase about $25,000, even without any increase in the number of plays. So I would keep that in mind, and somebody should check that carefully, because these numbers don't seem to agree what Ryan's analysis did, and he did a very careful job looking at numbers. And I know he speaks to Sean often, so there's some discrepancy. I don't think I'm going to read my statement because I'm out of time by by now. So, but I just wanted to make these 2 points, and I think Kathy covered some of the points that I wanted to say anyway. Thank you.
And Andrew, if you send me the written one, well, I think you did. We'll share it with everyone.
Thank you. Thank you. I did.
All right, and I'm going to bring in Michelle Miller to speak. Michelle, you're good?
Yep. Can you hear me?
Yes.
Okay, wonderful. Hi, everyone. So yes, I'm Michelle, and I am the chair of the Cherry Hill Working Group. And I also had a statement prepared, but I'm gonna just veer away from it a little bit because I think that it's already been discussed that the Cherry Hill Working Group unanimously voted to recommend this revolving fund. And that was after very careful analysis and really deep work that Ryan and the group put in. I wanted to just pull out a couple pieces here from what you've talked about. I've personally been walking the course quite a bit, and I'm a bit of a golfer. My kids both golf. I've been to multiple different courses, and I can say very clearly that this course is, from my opinion, I don't think it's an exaggeration to say that the course is not far from losing its footing operationally if we don't really begin to take a look at this more seriously. And kind of to piggyback on what Andrew was saying, it while I understand that there's an equity issue and that there's a certain salary model that you're all using, there's also supply and demand. And, we are actually facing a situation where with this $15 an hour position that's only being listed in one place, as far as I know, on the town's website, we've received no applications. And so, you go to the course on a day and you walk it and you see John there alone dealing with a broken down machine. And then you've got, a heavily trafficked, used golf course that's just deteriorating every day. And so to me, this is an emergency situation. And I want to say that I'm speaking, I don't want to speak for the committee entirely when I'm talking about this piece. But just again, personally walking it and seeing the deterioration that's happening and the lack of maintenance that John just is only capable of doing so much. So I think we have to, I think leadership has to think creatively and realistically about staffing. I think that there are considerations, but again, we have lifeguards, we have people working in the clubhouse. We don't have one application for a groundskeeper. So I guess I just pose the question, if we didn't have lifeguards, what would we do? We would have to take a look at why we weren't getting applications for lifeguards, and we couldn't just go without having lifeguards or our program would shut down. And so I know it's not like as easy to see it with the golf course because it still kind of feels like it's, moving along, but it is an urgent situation. And just like Lynn recommended you go check out the morning movement program, I recommend that you go walk the golf course. Leadership, walk the golf course, because it really is in from my perspective, it is in an emergency situation. Now, the other question I would like to put out is the gifts. I know that there are folks who are enthusiastic about Friends group, about donating to the course, but they're also feeling apprehensive to do that because to write a check means that you have to feel confident that the course is being operated and managed, well. And in addition to that, like when you're talking about hiring somebody, how do you hire somebody on a pay scale? Let's say someone wrote a check for $5,000 today and said, I only want this to go toward maintaining the course and the grounds, how would you get around the pay scale issue in that case? So like, while I understand that that's, you know, what has been said is the reason why we can't move forward and that we can do this gift, what's the practical solution if somebody does make a gift, and how would they go about making sure that somebody was hired at a higher pay scale, or that we would have somebody to do the groundskeeping that they donated their money toward? I think I'll stop there. Thank you so much.
Thanks, Michelle. And as I told Andrew, if you have a written comment that you departed from and you want to share it, just send it and I'll share it with everyone.
Thank you so much. Okay, thanks for all your work. Bye-bye. And thanks to Ray. Bye.
Thank you. And it is by my clock 1 minute of 3. And so, as everyone knows, we start next Thursday at 3:30, and it's DPW, enterprise funds, and sewer and water rates. And for the team that has done those questions last night, we learned from the council that the first reading for water and sewer will be June 1st. So we need to do them so that we can write up a recommendation and get it into the packets. So that would be separate from the overview of the budget. So just giving you a heads up on that. And I can talk to you later. And Lynn, I see that your hand is up. So I see Athena's hand is up. So
my question is really, when do you want the drafts that people are writing?
So the drafts, as soon as possible. So if all the departments we've seen, especially the early ones, if I could get it by next Monday morning, it would be great. And Lynn, I can talk to you about what we do with schools. We're still waiting for some follow-up. You know, if there's follow-up questions, it's not worth writing yet. And the DPW, which is Thursday, you clearly won't have it by Monday. But if we could get at least a rough draft, so I can start to try to piece it together. And I will do anything with an executive summary, because that's where we capture big issues. And then when we come together next week, it'll be a more focused discussion on any issues, concerns we had, any things we want to raise to a higher level. So did that answer that?
Do you also see, yes, it did. Do you also see attaching the incredible set of questions and answers?
Yeah, I think, this year, because Sean has done a composite, it's great. So when we do the report, I can talk to you, Sean, because it'll make the report even longer, but just attaching these to the back so that we don't have to verbatim repeat what someone told us, but we can keep referring to see the Q&A, and make an appendix.
Yep.
Great.
Does that work?
Thank you.
And I see Athena and then Kathleen.
Just a really 2 quick things. The report on the water and sewer rates can be very brief because there's a short turnaround period between when you're expected to vote on them on the 28th and the council's first reading on the 1st. So a short report for the water and sewer rates is just fine. And the other thing is that I just sent out invitations to councilors and finance committee members to the capital improvement public forum on June 1st. So I wanted to make sure that folks were aware. That's why they received an invitation to the June 1st meeting. For the public forum is at 6:30. That's it.
And that's so the resident members know you'll be up on the podium with us. It'll be a joint meeting. I mean, again, you can be not on the podium, but on Zoom, but you'll be in the room. Kathleen.
Yeah, I was just wanted to ask Sean if maybe if you have the answers to DPW and Enterprise, if we could get them in the packet for Thursday as soon as we can, just because I think it sounds like we're gonna have a pretty short time to, follow up, and we won't really be able to send them a lot of questions as follow-up. So it would be great to be able to read through that before they come, so we can just be prepared.
Yeah, I'll reach out to Gopher right now and get a status check on those answers.
And so, yeah, so just on the original schedule, I think I've said this before, but on the original schedule, I had next week, the 26th and the 28th, trying to get to the final report, but we have one more day. We have June 2nd. So next week, those days will be talking through if there are any things that we want to raise, cross-cutting things across all the departments, and people can look at the write-up from last year, cross-cutting themes, anything that was new and unusual, like I didn't know the recreation department was moving. But that would be something we would just want to make sure we capture, nor did I know that the cost for Wildwoods isn't in the budget yet with us taking it over. We've heard a few things going along the way, and that the rent for the 6th grade in the middle school isn't in the education budget yet, so we will have to figure out a way to, those are larger things that came out of these discussions, but we can talk about those next week on what we're highlighting at the higher level. Lynn?
Have you decided whether or not you're asking the superintendent to return?
I wasn't planning on it. Sean, you should see whether she wants to come back or just wants to go. And we wrote, please don't send us essays, just as short as possible. And Lynn, it was also, I think the chair of the school committee didn't feel like she had much time to respond either. So if we needed to, we could set an hour aside of one of the 2 meetings next week. But I didn't make that decision because I was waiting to see if we were even going to get responses.
Okay. I just think we need to give them a heads up and see
Yeah,
when they're
and
available.
if people would like to do that, actually, it's a good question to ask while we have everyone on. If people would like to have an hour where there's follow-up questions just on the education budget, you could raise your hand and say if you'd like that, and that would have to be on the 26th to make it work in terms of our schedule. Or you can send it to me. You can send it to me by email as you think about it. So are there any other comments or questions? All right, then I make a motion to adjourn at 3:05. Is there a second?
Second.
Kathy says yes. Lynn?
Aye.
Kathleen?
Yes.
Joe?
Yes.
Counselor Brevick?
Yes.
Tom?
Yes.
Anna?
Aye.
We are adjourned. And Sean, thank you again for amassing this document for us and being here to answer questions.
Yep, no
Thank
problem. Thank you all.
We are adjourned.